U.S. shutdown of HIV/AIDS funding could lead to 500,000 deaths in South Africa. USAID cuts to clinics dispensing antiretroviral drugs will be death sentence for mothers and children, expert warns. Sweeping notices of termination of funding have been received by organizations working with HIV and AIDS across Africa, with dire predictions of a huge rise in deaths as a result. After the U.S. announced a permanent end to funding for HIV projects, services across the board have been affected, say doctors and program managers, from projects helping orphans and pregnant women to those reaching transgender individuals and sex workers. The cuts could result in 500,000 deaths over the next 10 years in South Africa. Modeling suggests, while thousands of people are already set to lose their jobs in the coming days, the U.S. government has announced it will be cutting more than 90% of the contracts of its key development agency, USAID, and slashing $60 billion, £48 billion, of overseas aid spending. The Guardian has heard that notices of termination have been sent to organizations in other countries in the region, including Malawi, Zambia, Tanzania, and Zimbabwe, as well as with the joint United Nations program. UNAIDS, the Elizabeth Glaser Pediatric AIDS Foundation, said it had received termination notices for 3 of its projects, which provide HIV treatment for more than 350,000 people in Lesotho, Eswatini, and Tanzania. The figure includes more than 10,000 HIV-positive pregnant women, who must continue taking antiretroviral drugs to avoid passing the disease on to their babies. Dr. Lynn Mofenson, a senior advisor at the foundation, said the decision was. Many projects had been forced to stop work in late January after the Trump administration announced a 90-day review of foreign aid. A few were then granted temporary waivers to continue on the grounds that they provided life-saving services, before receiving notices on Thursday instructing them to close their doors permanently. Projects funded by the President's Emergency Plan for AIDS Relief, PEPFAR, founded by George W. Bush in 2003, appear to be particularly affected. In South Africa, it funds 17% of the HIV response. In other countries the figure is much higher. Professor Linda Gale Becker, director of the Desmond Tutu HIV Center at the University of Cape Town, said, "It is not hyperbole to say that I predict a huge disaster." Becker has worked on modeling suggesting a complete loss of PEPFAR funding in South Africa would lead to more than 500,000 extra HIV deaths over a decade. It comes at a time when scientific breakthroughs, such as the introduction of long-acting injectable prevention drugs, meant many working in the HIV field had hoped an end to the disease might be in sight. Now, said Becker, it was likely things would go backwards. South Africa has about 8 million people living with HIV, the highest number globally. She said she had initially expected the U.S. to target programs working with key groups of people such as the LGBT community, because of the Trump administration's attacks on diversity initiatives. But in fact, this has been across the board. This is children, this is orphans, vulnerable children, young women, and girl programs. It is generic and across the board. It also halts ongoing research, including trials into potential HIV vaccines and new prevention drugs. Becker said, U.S. funding had allowed projects to fill gaps in government provision, such as clinics where transgender people or sex workers can seek care without stigma or legal concerns, Becker said. Koli Buthelezi, national coordinator at Sisonke, a sex workers organization, said, "I've been having sleepless nights. This blow, it reminded us of back when there was no cure for HIV." At a press briefing on the cuts, she and others working on HIV in South Africa called on their government to step up and fill the gaps left by the U.S.'s withdrawal. PEPFAR funding has been distributed via USAID and the U.S. Centers for Disease Control and Prevention, CDC. Programs with funding from the CDC have not yet been forced to shut, said Dr. Kate Rees, a public health medicine specialist at the Inova Health Institute, but said it was too early to conclude that those programs were safe. There had already been plans to shift programs reliant on donors to government funding over the next 5 years, Rees said, but now, instead of a careful handover, we're being pushed over a cliff edge. U.S. funding had been embedded in the health system, she said, and so the withdrawal would be felt by everyone who uses or works in health services. Inova has received a termination notice. Tomorrow, we are letting go more than 2,800 people, Rees said. That's counselors, data capturers, healthcare workers, and these people are not going to find other jobs very easily.